Hi, my name is Ruthinder Kaur and I'm in class BSN 366 and I will be performing a central line dressing change per physician's orders. And for that, I have my nails all cut. They are not artificial nails, and I am not wearing my hair down. My hair is up, and I am not wearing any jewelry in my arms and no long sleeves. And I will be going into my patient's room right now and introducing myself and letting my patient know what the procedure is going to be. Hi, Joe, and I will be performing your central line dressing change. And can you please verify your name and date of birth for me? And the patient does verify their name and birth date, and I will provide the patient proper privacy and safety before I begin. Before I begin, I will have my patient look away from the site or give them a mask, and I will be also wearing a mask as well too. First, I will perform a hand hygiene, and I will put on my mask, and then after I put on my mask, I will put the mask on my patient, and then hand hygiene again, and I will put on my gloves, my clean gloves. And I will be removing the old dressing, and to do that, we are going to clip the line at the distal end away from it. So if this does not actually touch the line to the closest part. And then I will be, with my non-dominant hand, I will stabilize the line, and with my dominant hand, we'll be removing the dressing. And all four corners. And I will be removing the dressing away from the line so it does not take the line away, and then discard it. And then afterwards, I will be checking at the IV site for any inflammation, any redness, any swelling, any sign of infection. There are no sign of any infection. I will be checking the skin around it for any inflammation, any rashes, any redness, any swelling, or a sign of infection. There is no sign of infection. And I will be asking the patient if they are experiencing any pain, and the patient does not state that they are experiencing any pain. The patient states the pain level is 0 out of 10 at this point. And after discarding, now I'll remove my gloves and discard my gloves and perform hand hygiene. And we're going to begin our sterile process. I'll open my sterile frame, and I'm going to pinch and remove the sterile gloves. And I will be putting on my sterile gloves. And popping this one inwards right here. with keeping my hands above my waistline to keep the sterility of the procedure. And we are going to cleanse the site. I'll be picking up a chlorhexidine and gauze. Pick up the line with the gauze, and we're going to clean the site and around the site with the chlorhexidine for 30 seconds, back and forth. If it's a alcohol prep pad, then it would be in circular motion. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And I'm going to clean the underside of the tube. So this way, if I actually drop the tube, it is already clean now. It will be on the clean surface. And I will clean the upper side of the tube. And we're going to drop this right here. And I'm going to discard. And we are going to put the dressing on. I do not have the Tegaderm dressing. I already used it in the last video. So we're going to pretend this is my Tegaderm. I'm going to cover the site properly with, I'm going to press it down on all sides so it is covered properly. And we are going to put initials, date, and time. And we're going to discard the pen. I'm going to put this on the side so it's visible and it's not compromising the dressing. And now I'm going to remove all of my supplies. I'm going to discard my supplies. Here, and I'm going to take my sterile gloves off. And perform hand hygiene. And I'm going to remove my mask and discard it. And I'm going to remove my patient's mask and discard it and perform hand hygiene. And I will be putting my patient's bed lower, and I will be checking for any safeties, and I will ask my patient if he needs anything that I can do for anything for him, and I will make sure that the call light is actually within reach. Thank you.